My name is Belinda Balandya. I'm a doctor at the Muhimbili University of Health and Allied Sciences, where I practice as a lecturer, but I'm also an obstetrician and gynecologist at the Muhimbili National Hospital. I did an advanced fertility course in fertility care at Milan Hospital in Bangalore, India, under the support of Merck Foundation through the Merck Foundation More Than a Mother movement. I finished my studies in October 2018. This was a 3-month course. The course content included everything to do with how to talk to patients who have problems with fertility and how to sort of get the proper diagnosis through the history that you're going to take. And from that, how to examine a patient depending on the problems that they're having. After that, we were also taught how to properly examine a couple that is suffering from infertility. And from the results that you're going to get, then we were taught on how to properly treat the patients to help them go home with a baby. And so we had classes where we were taught like theory regarding the same, but also we had hands-on where we were going through how to do an ultrasound, and we did ultrasounds, and then we also were attached to various specialists, doctors who were attending patients. And also we were also going to the laboratory, and we also had a chance to see how the patients were managed on the area where the nurses are taking care of, where they are given medications and the likes. But we also went to the operating rooms. In the operating rooms, it was not only for issues to do with how to do, let's say, ovum pickups and embryo transfers, but also even the laparoscopic operations for those patients who are having infertility. Most of them were diagnostic, but also even the curative part, we were also able to see some of those. After I finished the course and came back here, my patient care for clients who are suffering from infertility had improved quite a lot. I am now taking better histories. I am performing very focused physical examination for both the female and the male partner, which normally we did not do as much. But I'm also able to request for investigations that will give me insight as to what may be the problem, and from that be able to provide a very good management for the patient. Previously, we used to do, let's say, for example, if you do ovulation induction, but then we were not like sort of following them up with an ultrasound. But now I know that after you induce ovulation, it is best to follow the patient, and then you will be able to advise. For example, if you're just asking them to time the intercourse, then it's easier to know when exactly they are likely to get a good outcome. And from this improvement in patient care, I've also been receiving referrals from other doctors who would ask for me to review their patients and take on their management with regards to their patients that they are attending. But also I have been able to sort of start clinics outside my normal routine clinics that I usually perform, and I am conducting clinics at Morogoro, where I visit them once a month to sort of review the cases that they have challenges with regards to fertility. This is in a private hospital. It's not in a government facility though. And also from the training that I had, then my teaching also has improved in terms of teaching students, especially master's students in fertility. As you know, I am a lecturer at the university here, so I teach students, both undergraduate and those who are doing masters, in which case they sort of go out with more knowledge than what I got when I was studying my masters. And I also sort of give education to patients in terms of camps. I've been invited to various camps where they are giving health education to talk to both men and women about issues concerning fertility and how best those who are having challenges to be able to get help, but also in the preventive part as well, because once you are able to prevent, especially those causes that are preventable, then you reduce a lot of suffering for the couples that are affected. From the exposure that I got through the course that I had, and when I came back, I realized there's quite a lot that needed to be done. We did not have embryologists in Tanzania, and so because of that and the challenges I was facing now after returning, they made me to want to do more in the area of fertility. And from that, I pursued a Master of Science in Embryology, and I just finished that course and planning to do more in the area of embryology because this is what is lacking most. And the advantage that I see myself having is I am able now to not only take care of the patient from when they come in and then leave the laboratory part to somebody else, because we are having challenges to have embryologists. So now I'm able to sort of do the whole spectrum with support from other people. And I would totally recommend Merck Foundation to others because I have seen the advantages that I had from the exposure that I got and how it has made me to sort of advance in my career in a special way. So may I take this opportunity also to thank Merck Foundation More Than a Mother movement for the opportunity that I got, and to keep up the good work and helping other doctors also to get this chance. Thank you.